Right, time to bring in our panellists now to break all of this down. Welcome Shane and Agnes. Agnes, I'll start with you. This was a good surprise for about 2 million Kiwis, wasn't it? They'll get this payment. It'll help, won't it?
Actually, the cost of living package, as they've put it, is actually pretty underwhelming. Cost of living has now actually pipped housing as the #1 issue facing New Zealanders. And look, no one's going to scoff, especially those families at the margins, at an extra $27 a week. But the reality is their cost of living pressures are going to extend beyond the term of this payment.
Yeah, well, yeah, Agnes is right, isn't she? $27 a week for a few months. It's not exactly a long-term strategy, unlike, say, a tax cut.
Well, yes, but for people under $70,000, under her party's scenario, they get $2 a week, where people like me get $1,800. Chris Luxton will get $1,800. $1,800.
A lot more.
A lot more
yeah.
tax cut, and of course she'll get an extra $4,000 in terms of tax deductibility for the 6 rental homes that he earns. This does deal to middle New Zealand, and you've got to take into other things to account. You've got to take into account the index of the winter heating funds. You've got to take into account the ratcheting up of benefits.
The people who get this payment don't get the winter allowance or the benefits.
You've got to take that all into account. Hey, look, I think it has. I think middle New Zealand will get some relief, but I think down the track more is needed.
Oh, certainly, yeah. after a couple of months. Because also, Agnes, the transport, the help at the pump and the free, the half-price public transport is a great move, but also just for a couple of months.
That's the problem. I mean, if they'd said it was permanent, that would be great, and that's what we really need. And look, the cuts have already happened, and yet petrol's already gone back up over $3. And so that just shows that it can't be temporary. That needs to be one of the permanent things that has to remain is to keep those cuts.
Yeah, because it's not a strategy, is it? It's a stopgap measure.
But how do we do that? How do we do that if we've got an alternative of tax cuts? So what does the alternative look like in terms of line by line deduction? We haven't heard that. Chris Luxton's been in charge of his party for 5-6 months.
One of the things he has said is that he wouldn't be spending the $11 billion on buildings and bureaucracy around the health sector, which is one of the biggest ticket items here, the $11 billion. Was that good money well spent?
What's happened, in fact, is that the debt has been taken away from the DHBs. It's been centralised, so it will mean that people that live in Tairāwhiti, Te Tai Tokerau, or Gore will get better access to the type of services they want. What we're doing, what the Labour government is doing away is 21 bureaucracies. What does 21 DHBs look like? It means 21 chair people, 21 boards, so that bureaucracy has been done away with, and you need a transition.
I mean, Shane's right, isn't he? Because what Grant Robertson and Andrew Little would say is that they're fixing up the massive underinvestment by previous governments, like National, and so they're having to pour all this money in here to fix that up.
No, because I actually think that there is actually more money. Great, there's a big budget, but a lot of it is still going into bureaucracy, into infrastructure. Sure, infrastructure needs to be looked at, but I think about Malcolm Mulholland, that they want more money for cancer drugs. And if it's a choice between more money into health bureaucracy or more money on cancer drugs, I think most New Zealanders would know where they want to put that money.
Well, because we need some hospitals that will stand up and not fall over like the one in Hutt Valley is going to do at the moment, but we also need people to staff those hospitals. And our health sector workers, they're burnt out, they're underpaid, and they're leaving the country. Yeah. This isn't going to help that, is it?
Well, in fact, wages, independent analysis, wages will go up by 6%. They'll get again in front of inflation.
But not because of this budget.
Well,
though.
No. In terms of the overall economic management, we're going to see within the next 2 or 3 years debt reduction to about 20%, where it has been in the past. There's a myth out there that we are an over-debted economy. We're not. IMF, hardly a friend of the left, they came out quite clearly this week and they said that our debt mechanisms are about right. Most of the spending over the last 2 years have been on critical issues in terms of COVID. $15 billion, I should say, in terms of keeping people connected to their work through wage subsidies, and of course a massive rollout of vaccination plans, which saw one of the lowest death rates in the world. So, those sort of things are
it's been a very tough time, no arguments there. What do you think, Agnes? Could the money be better spent elsewhere, though?
It's actually about we don't talk about execution, implementation, and what are going to be the outcomes from this amount of investment. These are huge numbers. But mums and dads want to know in health. Is it going to mean better services when they're at the doctors with their kids, if they've taken the elderly, if there's someone on the waiting list? What is the real outcome of the spend? And what I see is just more money on bureaucracy.
It's going to take a while, though, for all that to bed in. And don't we have to start somewhere with some leadership? I know bureaucracy in buildings are really boring. They don't probably win votes in the short term, but there are things that real leadership needs to focus on, so we're set up for the future.
Well, actually, when you say that the spend is on bureaucracy, that's not actually true. It's on infrastructure. We've got crumbling infrastructure in one of our Wellington-based hospitals, Miramore Hospital, which is in South Auckland, a very, very important place to Agnes and I. They need that infrastructure investment. So actually, it's buildings, bricks and mortars, and that's very important in terms of the delivery of healthcare of our people.
But let's look at their track record. I mean, infrastructure, big spend. Everybody want houses. They came up with Kiwi Build. Look what happened there. So we've got to look at the track record of this government on delivery, on execution, and they've just missed the mark. More social housing than ever before. More consents, more houses being built than ever before.
Consents, you can have all the consents in the
No, but there are more houses being built over the last 3 years than there has been in the last 6 houses.
Well, most of them have come to a grinding halt and they've cost a lot more than people bargained for.
There are more people being housed than ever before, but I accept there is a poverty gap in terms of social housing and people who continuously live in Struggle Street. Here's the question that I have for Aotearoa New Zealand: will a $2 tax cut fill that gap? And where's the money?
$350 over a couple of months. Okay, let's end on a positive. Agnes, what's one good thing? What's one thing you were heartened by in the budget today?
Oh, look, definitely anything around dental. So I know there was a grant there for beneficiaries. It's gone from $300 to about $1,000. I would love for that to be extended and actually be focused on children's teeth. And I think that if we can get more support around our kids' teeth and ensure that, going into the future long term, that we're going to minimise those healthcare problems for them as adults.
Okay, Shane, I'm not going to let you off. I'm not going to say one good thing. I'm going to say one thing they could have done better.
I think what they could have done better is they could have given this type of package to beneficiaries.
Okay, absolutely. Yeah, because they're excluded because they get the winter benefit, the winter energy payments.
And also, if we look at it on the overall scheme of things, again, under this government, the economic delivery for people on benefits have been far greater than in the past. That's just the reality.
Shane and Agnes, thanks very much for your time and for your thoughts tonight.